My name's Carlos. I'm 17 years old, and I currently go to school at South Valley Academy. Tested for ADHD, and I tested positive for ADHD, OCD, and dyslexia. My experience as a student with ADHD, when I was younger, ADHD wasn't really like a common thing talked about, or if it wasn't, I didn't really know about it. And I was just always treated as like the hyper kid that just never really sat quiet in class. I never really caused trouble in class, but I definitely wasn't ever the perfect student either. I was just always a very loud kid and always had a fidget with me, or always messing with something and always just messing with paper and stuff like that. A good part of my life, I was put on medication for my ADHD so I could concentrate and calm down. I was put on that medication from when I was diagnosed, from 4th to 8th grade. I was on that medication pretty constantly every day. It helped me for a bit, but eventually I developed some minor depression because it just mellowed me out so much, so I stopped taking that medication, and now I can control myself without the medication. Getting excited, being lazy and not focusing on what I have to do. If I don't work out on a regular basis, that'll throw me off and I'll get extra excited, extra just anxious, because working out and sports has really helped me a lot too as a student with ADHD. Now schools are understanding students with ADHD just a little bit better. Schools are realizing that ADHD is certainly something that's there and it's prevalent. You have to start off with the kids first, 2nd grade, start them off. Early awareness, if a student has ADHD, you don't necessarily have to tell them you're different, help work them through how to handle themselves in a classroom. Just as a student that has been living with ADHD for all their lives so far, just for teachers to just have patience sometimes, because I realize that, I'm a lot to handle. I'm a very loud student. I'm a very enthusiastic and just loud student. And thinking back on it, maybe if some of my teachers, I had a good teacher 5th and 4th grade, but maybe some of the teachers in 1st or 2nd grade or 1st in kindergarten, maybe if they would have had a little more patience with the students that obviously have ADHD, because I was a pretty predominant ADHD case. Just think about how that student as an individual not needs to be accommodated, but acts and just work with them. And it's a lot of work for each individual ADHD student or each individual student that has a different learning process, but in the end, it really helps us out. And now I don't have to. Now by this level, I don't have to have any accommodations because the teachers have worked with me to a certain point. So I'm fine now. I've certainly seen students with a much more predominant case of ADHD or ADD or OCD, and really, it's just remember it's out of their control. I never asked to be diagnosed with ADHD or OCD or whatever I've been diagnosed with. I guess diagnosis is what you would say. But it's out of our control, and I personally try my best to just act normal, and that's what most of us really want. That's what most of the kids really want. No one wants to admit, oh yeah, I have ADHD, or I have to go to a separate location for testing, or that can be embarrassing sometimes. So just try and, if you can, keep it confidential, and if they're not confidential about it, just realize they're working with themselves as hard as they can. Fellow students with ADHD, just know that it's tough. Yeah, it's tough, but you gotta find that thing that helps you focus. And remember that if you find it, then you're gonna be fine. And if a doctor puts you on medication, just realize that medication isn't what helps you. It's you helping yourself. And for the teachers, just know that our families are trying their best to work with you and getting our education done. And yeah, we're gonna we're gonna go to detention a lot more. We're gonna be a lot louder. We're gonna not get all our work done, but we're here in class doing our best most of our time. So just be patient.